Doctor, I've been having these terrible headaches for weeks now. They start right behind my eyes and spread across my entire forehead.
I see. Can you describe the pain for me? Is it sharp, dull, throbbing?
It's more like a pounding sensation, almost like someone's hammering inside my skull. And the weird thing is, it gets worse when I look at screens.
How many hours a day would you say you spend looking at computers or phones?
Honestly, probably 12 to 14 hours. My job requires constant screen time, and then I'm on my phone during breaks.
That's quite significant. Have you noticed any other symptoms? Blurred vision, sensitivity to light, nausea?
Yes, actually, the light sensitivity is getting unbearable. Yesterday, I had to leave a meeting because the fluorescent lights were making me feel sick.
And are you experiencing any dizziness or balance issues?
Sometimes when I stand up too quickly, the room spins for a few seconds. Is that related?
It could be. Tell me about your sleep patterns. Are you getting adequate rest?
Sleep? What's that? I'm lucky if I get 5 hours a night. My mind just races with work stress.
I'm noticing a pattern here. The combination of excessive screen time, poor sleep, and stress is likely contributing to tension headaches and possibly digital eye strain.
So this isn't something serious like a brain tumor? I've been terrified.
Your symptoms point to lifestyle factors rather than something sinister, but we should run some tests to rule out other possibilities.
What kind of tests are we talking about?
I'd like to check your blood pressure, do a basic neurological exam, and possibly refer you to an optometrist for an eye exam.
And if everything comes back normal, what then?
Then we focus on lifestyle modifications, reducing screen time, improving sleep hygiene, managing stress, and perhaps trying blue light filtering glasses.
I'm willing to try anything at this point. These headaches are ruining my life.
Good. Let's start with the examination today, and I'll give you some immediate strategies to implement. We'll have you feeling better soon.
Thank you, doctor. I really appreciate you taking this seriously.
Your health concerns are always important. Let's get started with that blood pressure check. I'm not really sure how to bring this up. It's kind of embarrassing.
Please don't feel embarrassed. I've heard everything, and I'm here to help. What's bothering you?
Well, I've been having some digestive issues, really bad stomach pain and other problems I'd rather not describe.
I understand it's uncomfortable, but I need details to help you properly. When did these symptoms start?
About 3 months ago, at first I thought it was just something I ate, but it keeps happening.
Can you describe the pain? Where exactly is it located, and what does it feel like?
It's right here in my lower abdomen. Sometimes it's a sharp stabbing pain, other times it's just a constant ache that won't go away.
Does eating make it better or worse?
Worse, definitely worse, especially after heavy meals. And greasy food, forget about it. I'm in agony for hours.
Have you noticed any changes in your bowel movements? I know it's uncomfortable to discuss, but it's important.
Yeah, everything's been irregular. Sometimes I can't go for days, then suddenly it's the opposite problem. And there's been blood a few times.
Blood in your stool is something we need to investigate immediately. Have you lost any weight recently?
Now that you mention it, my pants are fitting looser. Maybe 10 or 15 pounds in the past couple months?
Unintentional weight loss combined with your other symptoms concerns me. Have you experienced any fever or night sweats?
The night sweats have been horrible. I wake up drenched, have to change my sheets. My wife's been worried sick.
I'm glad you came in today. These symptoms warrant immediate attention. I want to order some blood work today, and I'll have my staff schedule you for a colonoscopy.
A colonoscopy? That sounds serious. Are you thinking it's cancer?
I'm not jumping to conclusions, but we need to rule out several conditions, including inflammatory bowel disease, ulcers, or yes, potentially cancer.
This is exactly what I was afraid of. Why did I wait so long?
Don't blame yourself. What matters is that you're here now. Early detection makes a huge difference in treatment outcomes.
What happens next? How soon can we do these tests?
I'm going to put a rush on the blood work today, and I'll have my staff schedule you for a colonoscopy within the next 2 weeks.
Will I need to take time off work?
For the colonoscopy, yes. You'll need someone to drive you home afterward due to the sedation, but it's a same-day procedure.
All right, I'll make it work. My health has to come first.
Exactly right. Let's get you checked in for that blood work, and we'll go from there.
I'm at my wit's end with this knee pain. It's been 6 months and nothing seems to help.
6 months is a long time to suffer. Walk me through what you've already tried.
Ice, heat, rest, over-the-counter pain medication. My regular doctor said it's just arthritis and to live with it.
Just arthritis? That's not a very helpful approach. Tell me about your pain levels and when they're worst.
Mornings are absolute torture. Getting out of bed feels like my knee is full of broken glass. It takes about an hour of moving around before it loosens up.
That's classic inflammatory arthritis. What about activities? What makes it flare up?
Stairs are my enemy. Going down is actually worse than going up. And forget about gardening, which I used to love. 20 minutes of kneeling and I'm done for the day.
Can you show me where exactly the pain is located?
Right here, on the inside of my knee. Sometimes it radiates down into my calf, and there's this clicking sound when I bend it.
The clicking could indicate cartilage issues. Have you had any imaging done? X-rays or MRI?
Just x-rays. They showed some arthritis, but the doctor said it wasn't severe enough to explain my pain level.
Interesting. Sometimes what we see on imaging doesn't correlate with symptoms. Let me do a physical assessment. Can you stand and walk for me?
Sure, but you'll see I'm limping. I try not to, but my body compensates automatically.
I notice you're favoring that leg significantly. How's your hip on that side? Any pain there?
Actually, yes. My hip has been bothering me too, but I assumed that was from the limping.
It could be, or the hip problem might be contributing to the knee pain. The body's all connected.
So what can we do about this? I refuse to accept that I just have to live with constant pain.
Absolutely not. We're going to develop a comprehensive treatment plan. Strengthening exercises, manual therapy, possibly a knee brace for support.
Exercises? But movement hurts. Won't that make it worse?
The right exercises, done properly, will actually reduce pain by strengthening the muscles that support your knee. Weak muscles put more stress on the joint.
How long before I see improvement?
Most patients notice some relief within 4 to 6 weeks of consistent therapy, but you have to commit to the home exercise program too.
I'm motivated. I want my life back. I want to garden again, play with my grandchildren.
Then let's make that happen. We'll start gently and progress gradually. Your knee will thank you.
When can we start? Today?
Today, we'll do the initial assessment and I'll teach you 3 basic exercises. Then I want to see you twice a week.
I think something's really wrong with me. I can't focus anymore, my heart races randomly, and I feel like I'm losing my mind.
Those sound like frightening experiences. How long have you been feeling this way?
It started about 4 months ago, right before my thesis defense. But instead of getting better after the defense, it's gotten progressively worse.
Describe what happens when your heart starts racing. What are you doing when it begins?
That's the terrifying part. There's no pattern. I could be sitting in class, lying in bed, or eating lunch. Suddenly, boom, my heart's pounding out of my chest.
And how long do these episodes last?
Anywhere from 5 minutes to half an hour. During the worst ones, I feel like I can't breathe, like the walls are closing in.
Have you experienced any chest pain during these episodes?
Yes, sometimes there's this tightness across my chest. That's when I'm convinced I'm having a heart attack. I've been to the ER 3 times.
And what did the emergency room doctors find?
Nothing. They did EKGs, blood tests, everything. They kept saying my heart was fine and that it was probably anxiety.
How did you feel about that diagnosis?
Frustrated, honestly. I mean, this feels physical, not mental. My heart is actually racing. How can that be anxiety?
That's a common misconception. Anxiety causes very real physical symptoms. Your heart racing, chest tightness, difficulty breathing, those are all manifestations of panic attacks.
But I'm not anxious about anything specific. That's what doesn't make sense.
Anxiety doesn't always have an obvious trigger. Sometimes it builds up from chronic stress, sleep deprivation, or even genetic predisposition.
I have been sleeping terribly, maybe 3 or 4 hours a night. My mind won't shut off.
Tell me what you're thinking about when you can't sleep.
Everything. My research, my future career, whether I'm smart enough, whether I'm wasting my time. Then I start worrying about not sleeping, which makes it worse.
That's called anticipatory anxiety, and it's incredibly common. Are you using anything to help you sleep?
I've tried melatonin, sleeping pills, even drinking before bed. Nothing works consistently.
Alcohol actually disrupts sleep quality. Let's talk about treatment options. Have you considered therapy or medication?
I'm scared of medication. What if it changes my personality or makes me unable to think clearly? I need my brain for research.
Modern anti-anxiety medications are quite targeted. Many of my academic patients function even better because they're not fighting constant anxiety.
What about side effects? I've heard horror stories.
Every medication has potential side effects, but we start low and adjust based on your response. Many people experience minimal side effects.
Could I try therapy first? Maybe I can manage this without medication?
Absolutely. Cognitive behavioral therapy is highly effective for anxiety and panic attacks. We can always add medication later if needed.
Okay, I'm willing to try. I can't keep living like this.
I don't know what's happening to me. I'm exhausted all the time, gaining weight no matter what I eat, and my hair is falling out.
Those symptoms together suggest we need to look at your thyroid function. Have you had your thyroid checked before?
My regular doctor ran some tests last year and said everything was normal, but I feel worse now than I did then.
Thyroid issues can be subtle and progressive. Let's go through your symptoms more systematically. You mentioned fatigue. How severe are we talking?
I could sleep 12 hours and still need a nap. I'm dragging myself through each day. Coffee doesn't even help anymore.
And the weight gain. How much have you gained and over what time period?
25 pounds in 8 months. I haven't changed my diet or exercise routine. If anything, I'm eating less because I have no appetite.
Gaining weight while eating less is definitely abnormal. Tell me about the hair loss.
It's coming out in clumps when I shower. My hair used to be thick, and now I can see my scalp in places. It's devastating.
I can imagine how distressing that must be. Are you experiencing any other symptoms? Changes in skin texture, feeling cold, constipation?
Yes, to all of that. My skin is so dry, it's cracking. I'm freezing even when everyone else is comfortable, and I haven't had a normal bowel movement in weeks.
These are classic signs of hypothyroidism. Have you noticed any changes in your mood or memory?
My brain feels foggy. I forget words mid-sentence, can't remember simple things. And I'm depressed, which isn't like me at all.
Depression is often a symptom of thyroid dysfunction. Has anyone in your family had thyroid problems?
My mother and grandmother both had thyroid issues. My mom takes medication for it.
That's significant. There's definitely a genetic component. I'm going to order comprehensive thyroid testing, including TSH, T3, T4, and thyroid antibodies.
Why didn't my other doctor test for all of that?
Many doctors only check TSH, which can miss subtle thyroid dysfunction. We need the complete picture.
If it is my thyroid, what's the treatment?
We'd start you on thyroid hormone replacement. It's a daily pill that supplements what your thyroid isn't producing.
How long before I feel better?
Most patients notice improvement within 4 to 6 weeks, but it can take several months to find the right dosage.
Will I have to take it forever?
In most cases of hypothyroidism, yes, but once we find the right dose, you'll feel like yourself again.
I just want my energy back. I have 2 kids who need their mom to be present.
Let's get that blood work done today. I'll have results in a few days, and we'll go from there.
Thank you for taking this seriously. My last doctor made me feel like I was imagining things.
Your symptoms are real and deserve proper investigation. We'll figure this out together.
My wife insisted I come in. I've been having chest discomfort, but I keep telling her it's probably just indigestion.
I'm glad your wife is persistent. Tell me about this chest discomfort. When does it happen?
Usually when I'm doing something physical, like mowing the lawn or climbing stairs, it's this pressure, like someone sitting on my chest.
That's concerning. Does the discomfort go away when you rest?
Yeah, after a few minutes of sitting down, it disappears completely. That's why I didn't think it was serious.
Actually, chest pain that occurs with exertion and resolves with rest is a classic sign of angina. Does the pain radiate anywhere?
Sometimes into my left arm and jaw, but I've always had a bad shoulder, so I figured that was related.
Have you experienced any shortness of breath, sweating, or nausea with these episodes?
Now that you mention it, I do get winded more easily than I used to, and I've felt nauseated a couple times.
These symptoms suggest your heart isn't getting enough oxygen during physical activity. Do you have any risk factors? High blood pressure, diabetes, high cholesterol?
All 3, actually, and I smoked for 30 years, though I quit 10 years ago.
With your risk factors and these symptoms, we need to evaluate your heart immediately. I'm ordering an EKG right now.
You're scaring me. Is this a heart attack?
You're not having a heart attack right now, but these symptoms indicate significant heart disease that needs treatment. What kind of treatment are we talking about?
That depends on what we find. Possibly medications to improve blood flow, maybe cardiac catheterization to look at your arteries. Catheterization? That sounds invasive.
It's actually minimally invasive. We go through an artery in your wrist or leg and can see exactly where blockages are.
And if there are blockages?
We can often treat them right then with stents, or in some cases, you might need bypass surgery.
Surgery? I'm 72 years old. Is it even worth it at my age?
Absolutely. We successfully treat patients in their 80s and 90s. You could have 20 more quality years ahead of you.
What if I just take medication and try to be more careful?
Ignoring these symptoms could lead to a major heart attack. The chest pain is your heart's way of saying it needs help.
I suppose you're right. My wife would kill me if I didn't do this.
Your wife sounds like a smart woman. Let's get that EKG done, and depending on the results, we may admit you for further testing.
Admit me? Today?
Chest pain with your history is an emergency. I'd rather be overly cautious than miss something critical.
All right, doctor. I'm in your hands.
This rash is driving me absolutely insane. I've tried every cream at the pharmacy and nothing works.
Let's take a look. How long have you had this?
About 6 weeks. It started as a small patch on my arm, and now it's spreading everywhere.
Can you describe the sensation? Is it itchy, painful, burning?
Itchy doesn't even begin to cover it. I wake up bleeding because I've scratched in my sleep. It's unbearable.
I can see the scratch marks. This looks like it could be eczema or possibly an allergic reaction. Have you started using any new products recently?
I switched laundry detergent about 2 months ago. Could that really cause this much of a reaction?
Absolutely. Contact dermatitis from laundry detergent is incredibly common. What about new skincare products, jewelry, or changes in diet?
I did start wearing this new watch band around the same time. It's supposedly hypoallergenic, but who knows?
The watch band pattern on your wrist suggests the watch band could definitely be a culprit. Have you noticed if the rash is worse in certain areas?
Definitely worse where clothes fit tightly. My bra line, waistband, anywhere there's friction or pressure.
That supports the contact dermatitis theory. Are you experiencing any other symptoms? Fever, joint pain, feeling generally unwell?
No fever, but I'm exhausted from not sleeping. The itching keeps me up all night.
The sleep deprivation is concerning. We need to get this under control quickly. Have you been using any steroid creams?
I tried hydrocortisone from the drugstore. It helped for like an hour, then the itching came back worse.
Over-the-counter hydrocortisone is too weak for this severity. I'm going to prescribe a stronger topical steroid and an oral antihistamine.
Will that actually work, or am I going to be dealing with this forever?
If we've identified the trigger correctly and you avoid it, you should see significant improvement within a week or two.
So I need to throw out my new detergent and stop wearing my watch?
Exactly. Switch to a fragrance-free, dye-free detergent and replace that watch band with something made of silicone or fabric.
What about my clothes? Do I need to rewash everything?
Yes, ideally. The allergen from your current detergent is probably still on your clothing, continuing the reaction.
This is going to be so much work. Can't you just give me a pill to make it go away?
The medication will help with symptoms, but if you don't eliminate the source, the rash will keep coming back.
Fine, I'll do whatever it takes. I just want to sleep through the night again.
Let's also talk about skincare routine. You need to moisturize heavily to repair your skin barrier.
More products? Won't that irritate it more?
The right products will actually help. I'll give you specific recommendations for sensitive skin.
Okay, I trust you. When should I come back if this doesn't improve?
My company requires me to get this physical, so here I am. But I feel fine, so this should be quick.
Annual physicals are important, even when you feel healthy. Let's start with your vital signs. Your blood pressure is quite elevated, 160/100.
It's probably white coat syndrome. I get nervous at doctor's offices.
That's certainly possible, but this is quite high. Do you monitor your blood pressure at home?
No, why would I? I told you I feel fine.
High blood pressure is called the silent killer because you don't feel symptoms until serious damage occurs. When was your last physical?
Maybe 5 years ago? I've been busy. Driving long hauls doesn't leave much time for doctor visits.
5 years is too long. Let's review your health history. Any diabetes, heart disease, or stroke in your family?
My dad had a heart attack at 55, but he was overweight and smoked. I don't smoke.
Do you drink alcohol?
Sure, a few beers after a long drive helps me relax. Maybe 6 or 7 beers 3 or 4 nights a week.
That's significantly over the recommended limits. What about your diet on the road?
Truck stop food mostly. Burgers, fries, whatever's quick. I know it's not great, but it's convenient.
I'm concerned about several risk factors here. High blood pressure, family history, excessive alcohol consumption, poor diet. Your weight is also in the obese range.
Obese? That's a bit harsh. I could stand to lose a few pounds, sure.
According to your BMI, you're 40 pounds over a healthy weight. Combined with everything else, you're at serious risk for heart attack or stroke.
You're being dramatic. I haul 50,000-pound loads. I'm strong.
Strength doesn't protect your cardiovascular system from these risk factors. I want to run a full metabolic panel, check your cholesterol and blood sugar.
More tests mean more time off work. Can't you just give me some pills and call it good?
I need baseline numbers before prescribing anything, and medication alone won't fix this. You need lifestyle changes.
Here we go. You're going to tell me to eat salads and join a gym.
I'm going to tell you that your current path leads to disability or early death. You're 57. Don't you want to see retirement?
Of course I do, but I can't exactly cook healthy meals in my truck.
There are strategies for eating better on the road, choosing grilled instead of fried, packing healthy snacks, cutting back on portions.
And the drinking?
Needs to be drastically reduced. 6 beers several times a week is damaging your liver and contributing to your blood pressure.
My job is stressful. I need something to unwind.
There are healthier stress management techniques. Exercise, even just walking, can help.
When? I'm driving 12 hours a day.
Federal regulations require breaks. Use that time to walk around the truck stop instead of sitting in a restaurant.
You make it sound simple.
It's not simple, but it's necessary. Your father had a heart attack at 55. You're 57. Think about that. I've been experiencing some unusual symptoms, and I'm worried something might be seriously wrong.
I understand your concern. What symptoms have you been noticing?
My periods have become incredibly painful. I'm talking doubled over, can't function level of pain. And they're getting heavier, too.
When did you first notice the pain becoming worse?
About a year ago. At first, I thought it was normal period cramps, but now it's interfering with my work. I have to call in sick.
Describe the pain for me. Is it constant during your period, or does it come and go?
It starts a day or two before my period and lasts through the first 3 days. It's this deep, cramping pain in my pelvis that sometimes shoots down my legs.
Do you experience pain at any other times, during intercourse, bowel movements, or urination?
Yes, actually. Sex has become painful, which is straining my relationship. And I've noticed pain when I go to the bathroom during my period.
These symptoms together suggest possible endometriosis. Have you heard of that condition?
Vaguely. Isn't that where tissue grows outside the uterus?
Exactly. Endometrial tissue that normally lines the uterus grows on other organs, causing pain and inflammation. It's more common than most people realize.
Is that why my periods are so heavy? I'm going through super tampons every hour.
Heavy bleeding can be associated with endometriosis, but it could also indicate fibroids or other conditions. We need to investigate further.
What kind of investigation? More blood tests?
Blood tests can show anemia from heavy bleeding, but to diagnose endometriosis, we typically need imaging and possibly laparoscopy.
Laparoscopy? That's surgery, isn't it?
It's minimally invasive surgery, where we make small incisions and use a camera to look inside. It's the gold standard for diagnosing endometriosis.
That sounds scary. Is there any way to avoid surgery?
We can start with an ultrasound to look for other causes like fibroids or ovarian cysts, but if those are normal and symptoms persist, laparoscopy provides definitive answers.
If it is endometriosis, can it be cured?
There's no cure, but there are effective treatments to manage symptoms: hormonal therapy, pain medication, and sometimes surgery to remove endometrial tissue.
Will this affect my fertility? I want to have children someday.
Endometriosis can impact fertility, but many women with the condition successfully conceive, especially with proper treatment. Early diagnosis is actually helpful.
How soon should we do these tests?
I'd like to schedule your ultrasound within the next week or two, and let's do blood work today to check your iron levels and rule out other issues.
What can I do in the meantime? The pain is really affecting my quality of life.
I'll prescribe stronger pain medication, and we can discuss hormonal options that might help regulate your periods and reduce pain.
Will the hormones have side effects?
Possible side effects include mood changes, weight fluctuation, and headaches, but many women tolerate them well, and the benefits often outweigh the drawbacks.
I'm willing to try anything at this point. I just want to feel normal again.
I wasn't sure if I should come in, but my wife noticed this lump on my neck and insisted. It's probably nothing.
It's always better to get things checked out. Let me feel where you're talking about.
Right there, on the left side. It's been there for maybe 2 months, but it seems to be getting bigger.
I can feel it. It's a swollen lymph node. Have you been feeling sick? Any infections, fever, night sweats?
Actually, yes. The night sweats have been terrible. I wake up completely drenched, and I've been more tired than usual.
Have you lost any weight without trying?
My pants are looser, maybe 15 pounds over the past 3 months, but I figured that was from stress at work.
These symptoms together are concerning. Have you noticed any other swollen areas? under your arms, in your groin.
Now that you mention it, I can feel something under my left arm, too. Should I be worried?
I don't want to alarm you unnecessarily, but swollen lymph nodes combined with night sweats and weight loss need immediate investigation.
You think it's cancer, don't you? That's why you're being so serious.
It could be many things, including infections or inflammatory conditions, but we need to rule out lymphoma or other cancers.
Lymphoma. That's what I was afraid you'd say. My brother had that. He died.
Lymphoma treatment has advanced significantly in recent years. Many types are highly treatable, especially when caught early.
What happens now? Do I need a biopsy?
Yes, we need to remove a sample of the lymph node to examine the cells. It's an outpatient procedure under local anesthesia.
How soon can you do it?
I'll have my scheduler set it up for this week. Time is important, but a few days won't make a significant difference.
And then what? How long before we know?
Pathology results typically take 3 to 5 business days. Once we know what we're dealing with, we can create a treatment plan.
What if it is lymphoma? What's the treatment?
That depends on the type and stage. Common treatments include chemotherapy, radiation, immunotherapy, or combinations of these.
Chemotherapy. God, I've watched people go through that. It's brutal.
Modern chemotherapy has fewer side effects than older protocols, and we have excellent supportive medications to manage nausea and other symptoms.
Will I lose my hair?
Some regimens cause hair loss, others don't. If yours does, the hair grows back after treatment ends.
I'm trying to stay positive, but I'm terrified. How do I tell my family?
Let's wait until we have definitive information. No point in worrying everyone until we know what we're dealing with.
You're right. One step at a time.
Exactly. Let's get that biopsy scheduled and we'll go from there. You're not alone in this.